Toughness Fadila, and today I'll be presenting to you about intravitreal injection or IVT and what we nurses need to know. Alright, before we begin, let's take a couple of minutes to know each other. For myself, I've been an ophthalmology nurse for 4 years now. I came here with an objective to learn more about the eye. My time here has taught me on the various eye conditions and its diseases and what are the treatments for it. I'm also one of the nurse-led injector in this clinic. So now tell me about yourself. Right, thank you. So I hope you will have a great journey with us in the clinic. Let's begin the lesson, shall we? So the lesson objectives for today, we shall identify the external structures of the eye, the landmark for IVT injection, the consent for procedure, pre-procedure tests required for IVT injection, medications used for IVT, and understanding the importance of timeout, steps and requisites for IVT procedure, what to document, and also the post-procedure advice for patients. So now, coming back, bringing you back to your school, the eye anatomy. So can you see this is the external eye structures. So for our clinic, the IVT procedure is done by a doctor or a trained physician to deliver the medications directly into the vitreous cavity to treat the common diseases such as AMD, which is the age-related macular degeneration, or otherwise diabetic macular edema. So the injection, the location for where the injection is done is actually the sclera. So the common landmarks, actually for different procedures, you can inject different areas to the eye. So for us in Singapore and in our clinic, we commonly administer IVT injection through the intravitreal route. So now let's move on to consent. So as what you were taught in schools, the same thing applies here in our hospital and our clinic. So for consent, the important thing is patient's details, which is their name, their birth cert number or registration number, and also followed by their date of birth. The name of the procedure, so for example, in the consent, you can see that this patient consented for left eye injection. So the consent will state left eye intravitreal injection of Lucentis. So in the consent, it states which eye, the route, and the name of the medication. Then followed by the signature or the thumbprint of the patient, the consenting doctor, and also witness, or if there's any interpreter. The consented date that they took, it has to be 6 months validity. So for patients who are mentally incapacitated, meaning like dementia, or patient is intellectually disabled or anything like that, so we need to take a double consultant consent. Alright, so for pre-procedure test, we need to obtain the patient's VA, which is the visual acuity. Ensure no sudden drop in the vision, not more than 2 lines. So meaning, let's say today, previous visit patient's VA was 612, and today's visit is 660. So if you were to look into the VA chart, you can see at the corner it will state the reading. So if it's more than 2 line, meaning it's more than 612 by right, it's supposed to be at least about 618 or 624, for example, but the patient turned up with 660, they need to explain to the doctor. The IOP has to be within 10 to 24, and the vital signs has to be within normal range. So if any of these differ from the normal range, you have to inform the doctor before the procedure. For medications, our clinic carries 3 different medications: Lucentis, which is about 200 plus, Babysmo, which is about 600, and Eylea is about 900. So now for timeout, ensure patient is ready seated on the procedure chair and the physician is ready before calling up for timeout. Make sure the room is conducive, meaning no noise, no distractions occurring, because it's important when timeout, everyone stop what they're doing and focus on what is happening, which is the procedure. So it's important for the room to be free from any clutters, because we don't want any obstacles to happen, like the patient falling, doctor falling, or you falling during the procedure. So the requisites, which is the IVT set, needle, iodine, chlorhexidine if the patient is allergic to iodine, normal saline, tetracaine, and alcohol wipe to disinfect the trolley. So for procedure nurse, you need the cap, apron, mask. For doctor, there's an added-on sterile glove. For patient, it's just surgical mask and cap. So it's important to also verify the patient's allergy status, because we commonly use tetracaine, which is the numbing eye drop, and iodine for the procedure. So for the steps, later I will show you guys. Don't worry about this. It's good to know. Later we can open this while preparing. And then we skip to the documentation part, which is actually the batch and the expiry number needs to be documented in the system. The name and the name of the procedurist and the assisting nurse, followed by the post-procedure vital signs. Now I'd like to focus more on the patient education. So after the injection, you just reinforce to the patient, okay, Miss Tan, today you had injection to your left eye. The medicine is Lucentis. So it's important that you do not rub your eyes for 3 days, because we don't want any germs to go into our eye. And when you rub it, you may cause infection. Normal side effect, which is the floaters and subconj hemorrhage, meaning the floaters actually mainly comes from the medication, the tiny bubbles from the medicine. So it will go away on its own, don't worry. The red flags that you need to look out for important is the worsening pain, worsening blurring of vision, and then your eye is very red, like bloodshot red, or any flashes, or you feel like there's a darkening in the vision. So if any of these were to occur, please come back to the clinic immediately if it's during office hours. If after office hours, unfortunately, you need to go to the emergency department. Alright? Okay, now let's begin with the hands-on part. So now, hand rub is readily available at all working stations. You prepare the set, this is how it's supposed to look like. So now, for the patient's eye, look at the anatomy. Okay, it's just a dummy. So this is the eye. the doctor will inject over here, which is the sclera, the area here. So the most important thing is you have to give a patient a target, maybe a figure to look at. So what you do is you just give the patient like, okay, you look over this direction, just focus at one direction so that the doctor can do the injection. If not, the patient will keep moving up and down. So once injected, the medication will go into the vitreous body.